So what is autistic burnout? Autistic burnout is this combination of physical, mental and emotional exhaustion that just has accumulated on us from stresses of everyday life and interpreting the world differently, and it just builds up and builds up and builds up until we just can't do things anymore. So what could some of the signs of autistic burnout include? Now, the first one is obviously, like I've just said, feeling chronically drained, feeling chronically exhausted. And like I've just said previously, if you think of exhaustion, times it by 100, and that's how autistic burnout feels, or it did for me anyway. It just literally felt like my whole life came crashing down and I could no longer function on a normal level like I could do previously. And as a result of that, it can lead to chronic tiredness, feeling like, I used to come home and I used to have half an hour from a dinner break, and I'd come home and I'd go to bed for 15 minutes because I just needed to sleep. Or on my dinner break, I'd sit in my car and I'd shut my eyes and I'd go to sleep. I'd set my alarm clock. And it's not really a normal thing to do in our everyday job setting or our everyday life setting, to be constantly tired, but all I wanted to do was to sleep. So I think feeling extremely tired, and even feeling tired after you've had a nap, after you've been resting, when you wake up in the morning, we all feel, a lot of us, we all feel to some extent grumpy and tired, and we don't want to go to work or whatever in the morning. But most people, once they've had 8 hours, at least 6 to 8 hours rest, might feel a little bit refreshed. For an autistic person going through burnout, from my experience, going to sleep, it's almost like I've not slept and I still feel like I need another 8 hours sleep or another 8 years sleep, and that is how autistic burnout feels for me. So another sign of autistic burnout is this increased in sensory sensitivity. So autistic people, we can be really overwhelmed by bright lights, loud and sudden noises, for example. And I think when you're going through a state of exhaustion and tiredness, chronic extreme tiredness, we can get more easily overwhelmed by bright lights, loud noises. So the things that usually trigger us with autism and cause, say for example, a startle reflex, or cause a meltdown or a panic or an anxiety attack, can become heightened when you're going through autistic burnout. Another sign of autistic burnout is this increased in problems with executive function, planning, making tasks, making plans and sticking to plans. And it feels like the world becomes a little bit disorganized, and it can be really difficult for autistic people in general to sort of make plans and stick to them, especially if somebody's got ADHD, that's attention deficit hyperactivity disorder, or they've got executive dysfunction diagnosed on top of that. But if you're struggling with planning, organizing and completing tasks, more so now than you ever was before, it could be a sign of autistic burnout. Another sign of autistic burnout is you'll notice an increase or an uptick in autistic meltdowns. If you don't know what a meltdown is, it's this overwhelming response to a stressor or a series of stressors or a series of triggers, like sensory overload, bright lights, loud noises, changes in plans, changes in routines. Sometimes these things can accumulate on us, social interactions, spending loads and loads of time in a social gathering, and that can just deplete our energy. And it can result in something called an autistic meltdown, which can be crying, it can be giving somebody the silent treatment, it can be withdrawing back to bed. I often do that, just go to bed for an hour or something, just to get away from the stressor, just to recoup my energy. I often call other people energy vampires. It feels like this when I spend time with people, it feels like the person is sapping my energy from me, like I'm absorbing their emotions, and it can be incredibly draining for autistic people. But I think if you're noticing an increase or an uptick in the number of meltdowns that you're experiencing due to the number of you're more sensitive to other people, you're more sensitive to crowded environments, you're more sensitive to the triggers that usually affect you, it could be a sign of autistic burnout. Another sign of autistic burnout is coming back to if you're around crowds of people and an uptick and an increase in sensory triggers and overload. You might find yourself withdrawing more from other people or family and friends, and the hobbies and things that you liked to do previously, you might find yourself avoiding those situations completely because what's happening is your battery level. So you can imagine a Duracell battery which is full and you've freshly bought it from the shop, and you plug it into some fairy lights. Eventually the battery's going to die down and the fairy lights are going to dim out, and that's like autistic burnout. Our battery level, which once was completely full, has been drained and drained and drained and drained over time, and so we don't have much energy left in it. So our lights are dull, our fairy lights, our internal lighting system has dulled down so much that we're trying to conserve the small amount of energy that's left in our internal battery, and we're having to use that for our own benefit, for brushing our teeth, for brushing our hair, for things like that, life things. We're conserving and using our energy for things that are really important, eating our meal, for example. And these things still drain the energy, but you might find yourself withdrawing from social gatherings, withdrawing from friends and family, and that could be a sign of autistic burnout. And it literally is your body's natural way of trying to protect itself and conserve its energy. And then with all of this combined, you can often find that you might lose certain skills and certain basic skills that you once was able to do effectively, if we can use that word, and you might find that things become more difficult. And that is literally coming back to what I've just said, coming back to the social battery model. When your Duracell battery is nearly flat, it can become more difficult then to complete simple tasks like brushing your teeth and brushing your hair. And all of these things combined lead inevitably to this uptick or this increase in anxiety. And anxiety, I've said it over and over again, is one of the most common co-occurring conditions that go alongside autism spectrum conditions. But when you're feeling overwhelmed, when you're feeling like you've got nothing left, no energy left to give to others, it often increases the sense of anxiety. And then you're expected then to go into a work environment, for instance, and you might find yourself getting symptoms of anxiety and panic attacks, and that's just literally your body's way of sort of fighting back and protecting itself. And then of course, because you're feeling tired, you're feeling exhausted, you're feeling heightened sensitivity and increased meltdowns, and you're just sleeping all the time, or you're withdrawing, or you're going into a complete shutdown, that can often lead to low mood and depressive episodes. And I think that can be really common with autistic people. And then often we'll go to the GPs and we might be diagnosed with anxiety disorders or depressive episodes. And a lot of the time, which is why I'm making this video, it's really important to establish, especially if you've got an autistic patient, an autistic person from a GP perspective, from a doctor's perspective, or a nurse's or a psychologist's perspective maybe, to identify, is this an autistic meltdown or is this a depressive episode? And I'm not saying that depression doesn't co-occur with autism, because it does. A lot of autistic people have other co-occurring conditions like anxiety and depression, but a lot of the time doctors and healthcare providers can misdiagnose people with depression and sort of overlook the fact that it might be an autistic burnout that person's going through. Causes autistic burnout. Now, I've talked about that previously. It's usually, I mean, for me anyway, the main cause for me was this long-term masking, this pressure of having to leave my front door, go out into everyday life, take my alien mask off and put a human face on and smile and talk to people and make the same conversation. Autistic people will often make repetitive conversation. We have like a pre-scripted dialogue in our minds that we've sort of written it almost like a novel in our minds. So when we meet somebody, I know I do, I'll often have the same sort of conversation and dialogue with people because it's pre-scripted. And having to do that when you go to work and you take your alien mask on and put your human mask on, for example, and you're having to mask and camouflage, I know that sounds really weird what I've just said, but it's just how autistic people feel. It feels like we're different on this planet, and the planet feels a little bit alien to us, so bear with me with that. But having to then go out and navigate the whole social situation with masking on top of it and acting and having to make the same repetitive dialogue consistently, especially with me in the NHS, I was constantly having to make the same repetitive conversations with patients, 20 patients, sometimes more, every single day for nearly 20 years, and then colleagues and co-workers, and it's incredibly exhausting, and it leads to chronic stress and this increase in pressure and this increase in meltdowns, and also there's a mismatch in expectations from other people. So when you start to feel burnout and you're not working as effectively as what maybe you should be, your co-workers and your managers and your friends and your family and your loved ones might start noticing that and wondering why you've changed from this person that was once functioning to this person that's now struggling. And that can put more pressure and more stress on us to try and put another mask on, and then it's using up our autistic battery and it's draining us even more. And then of course, adding on to that, a lot of people don't understand about autistic burnout, and so coming back to what I've just said, they might be diagnosed with depression when it might be autistic burnout and not depression. It might be this chronic state of exhaustion from masking and dealing with a world that feels incredibly alien to us. And so when we feel a lack of support when we're going through that, it can feel incredibly underwhelming, and oftentimes, especially in employment situations, people might not their fault, but they might not understand about autism or autistic burnout. And so if certain accommodations are not put in place for us, such as reasonable adjustments, a reasonable adjustment is something that an employer, and it's usually free, especially with autism, will put in place in that work environment in order to allow an autistic person to work as effectively as somebody that doesn't have autism. So if there's a lack of understanding surrounding autistic burnout and accommodations and reasonable adjustments aren't put in place, it just increases the pressure on us, and we're expected to then maintain this persona of masking, which further depletes our autistic battery, and then it further leads to burnout, and eventually it's going to inevitably lead to a total shutdown. If you feel like you're going through autistic burnout, I want you to know that you're not on your own. I've been through it myself and I know exactly how it feels, and I wouldn't wish autistic burnout on anybody. I think the best thing you can do, if you've got supportive family and friends around you, if you've got a good support network, and if you're comfortable in doing so, it might be worthwhile just having a conversation with them and just explaining, I feel tired, I need time off work, I need some annual leave, or even taking time off work and explaining to your manager that I have autism, or I'm waiting for an autism diagnosis, I think I might be autistic, whatever the reason might be, and I'm struggling a little bit at the minute. And hopefully you've got a good employer that can support you around that, and maybe put in accommodations for you, maybe give you more breaks in between your work schedule, maybe move your desk to an area that's in a darker room, that's quieter, maybe allow you to eat your dinner in a place where you're on your own and it's quieter, might be able to make safe spaces for you where you can just take a little nap on your 15-minute break, and just explain. And I mean, there's even like flexible working, so you might be able to even change your working hours where you can get a little bit more sleep or leave earlier in the day, maybe start earlier and leave earlier, or however it works out for you. So it is worthwhile just having a conversation with your family, with your friends, and with your employer as well. Usually most employers are really supportive when they know that you've got autism, or you might be referred to occupational health first for an initial assessment, but usually they're quite supportive. And just saying that I feel tired and I'm struggling, because at the end of the day, you deserve to not feel that way, and you deserve to live a happy life and a productive life. And if your body needs rest, it needs rest, and that's that. We do have autism. It is a genuine neurodevelopmental condition. So just be kind to yourself. If your body's telling you that you feel tired, listen to it, because it's telling you that you feel tired for a reason. And it just means that you need to maybe escape from that situation for a bit, recoup your energy, do things that are positive for you so that you feel better, and then you'll come out of it on the other side feeling completely refreshed and back to yourself again. So I hope this little video has helped you to better understand a little bit more about autistic burnout. If you've enjoyed my video, please consider hitting like, commenting and subscribing, and I shall see you next time on my next vlog. Bye!